are spanking enthusiasts clogging our emergency rooms? Are they are they is there a line out my door on Monday morning?
Hey everyone, welcome back to my channel. I'm really excited about this week's video, but before we jump in, I just wanted to say, as always, that I do hope you'll consider subscribing if you want to. Subscriptions really do help. And if you're like super in love with this channel and want to help out even more, please consider signing up on patreon.com/kinkingoutloud. I've been demonetized, which means I can't make money from ads, so my Patreon friends really are the only ones keeping this crazy train on the tracks. And if you do sign up on Patreon, you'll get access to our Kinking Out Loud Discord group, which, in my totally unbiased opinion, is the best Spanko social network online these days. This week, I'm so excited to share an interview I did with Dr. Charles Moser. Dr. Moser is board certified in internal medicine, and he has a private practice in San Francisco that specializes in sexual medicine. He has an MD from Drexel University and a PhD in human sexuality, so, this guy's the real deal. He knows what he's talking about. I think we can really trust his advice. Dr. Moser is the president of the Diverse Sexualities Research and Education Institute, and he's the author of just a huge number of journal articles about human sexuality. Personally, I really enjoyed an article he did in 2016 called Defining Sexual Orientation that was in the Archives of Sexual Behavior. If you want to read it, I'll put a link to that article in the description, as well as a link to my own video about sexual orientation. So I've had nagging questions about the medical health and safety of this thing we do for a long time, and I know a bunch of you do too. But it's hard to get answers to these questions because it's freaking awkward. I don't want to go into my doctor's office and say, "Hey doc, is it cool that I keep putting ginger up my butt?" So that's why I put together a list of some of my own questions, and a few other questions were submitted by members of the Kinking Out Loud fam, just so, we could finally ask Dr. Moser directly and get some answers. So, a big thank you to Dr. Moser for taking the time to chat with us, and without further ado, seriously, is it okay that I keep putting ginger up my butt? Enjoy. Let's just start with the fundamentals. What basic medical or health safety information do spanking fetishists need to keep in mind for practicing spanking in a medically safe and healthy way?
When people say that, is it physically healthy? Is it emotionally healthy? Is it some combination of the two? There are an awful lot of people who love to get spanked, and it's almost impossible to do any harm. And then there are people that you can start spanking and it triggers them back to something in their childhood or some traumatic experience. And then the spanking is over and you're in recovery mode.
Well, so I will say that in the Kinking Out Loud community, people are very well educated about things like negotiation and consent and talking until you're blue in the face before any play begins. So these are all the people who watch this channel are mostly very active and involved in the Spanko community. They just sort of had some medical questions and were wondering if there's anything that a physician might know about what to avoid or what to keep in mind that they, as non-physicians, might not be aware of.
Well, it's interesting because I like to be a scientist about all this. And then you say, well, in the study by Jones and Smith in 1986, they found. But of course, that study doesn't exist. There's essentially no medical information about spanking. But what we do have are things like, what are the sorts of injuries that a football player might have by continually falling on their butt and getting it bruised, which does happen.
I love that because sports are kind of a form of impact play, if you think about it.
That's right. So when you look at that, obviously, sort of the distinction is if I have a 80-year-old, 90-pound woman who wants to be spanked, you can probably do a lot more damage to her than a 200-pound, 25-year-old guy. And so you have to just sort of start with, where the person is. And I think it's probably reasonable to say, especially if it's your first time with a partner, start slow, work your way up.
And well, it's very reassuring to hear that. It sounds like, more or less, it sounds like you don't think there are major medical risks to this kind of play, which I think a lot of people will be happy to hear. Yeah.
That's correct. There's a few
Awesome.
very rare complications, mostly of what we call crush injuries. If you
Crush
imagine,
injuries.
yeah, imagine someone is in a motor vehicle accident and they get hit and do damage to their butt or legs or something, or crushed. That leads to the inside of the cells to be dumped into your circulation and can stress your kidneys or whatever. I've never seen anyone get that from spanking.
Right. You're talking about like automobile collisions, which is obviously
Right.
a much greater form of impact than a spanking.
Right. And so, if somebody says, gee, I love to be spanked to the point that everything is black and blue, and then I go on, and by the way, it's great if I get hit with an oar from a boat or something. At some point you have to say, how much damage are you really doing?
So that brings us to the second question. And I should mention that a lot of these questions were submitted by members of the Kinking Out Loud community. And I'm so grateful to them. And I'm so happy to answer the questions that they really have, because it always feels better to give people practical information that they actually want. So the next question that was submitted is, some spanking fetishists like to play to the point of broken skin. And they were wondering, are there any health guidelines that people who prefer to play this way should keep in mind, other than intuitive things like, if skin breaks, use antiseptics or clean the area in an appropriate way. But is there anything else to keep in mind?
Well, anytime you break the skin, you're open to infection, and even using antiseptics doesn't necessarily prevent that.
Oh, wow. I had no idea.
Look, if you cut your finger and it gets infected, you can put antiseptic on it all you want. The infection is deeper.
Okay.
All right. You also want to be a little bit careful, not necessarily that you're going to get infected, but if you do get infected, go see a doctor.
Okay. Yeah, that makes sense. The next question is there anything to keep in mind for people who like to administer or receive a spanking over pre-existing bruises?
If you have a bruise, obviously what that means is that a blood vessel was broken, there's bleeding into the tissue,
okay,
and it's going to heal. But if you spank on top of that and you break that blood vessel again and again and again, two things are likely to happen. Your body's going to say, hey, whatever the owner of my butt is doing is I need to protect my butt. And if I'm protecting my butt, it's sort of like a callus. You're going to make a callus. So that becomes one piece of that. The second is, if you keep spanking on top of a bruise, you get more blood and more blood. You get something, the red blood cells, which break, have a iron compound in it that discolors the skin. It's called hemosiderosis. Okay. And hemosiderosis, you may like it at the time, but most people don't like a brown splotchy butt. They might like to avoid that. Now, there are some ways of trying to get rid of it, but it's much easier never to get it. So if you have a big bruise, the best thing to do is to spank around it, or spank another area, or spank another, in a different way, so you don't break those blood vessels.
Okay, so I know that I'm jumping ahead in the list of questions here, but since it's relevant, is this the explanation for why so many of us just lose the ability to bruise after a couple of years?
It's sort of the callus formation. I was trying to look this up to see. We know that football players, for example, get this. Their butts become sort of toughened because they're falling on their butt all the time.
Yeah.
And what I tried to figure out reading literature is, how long does it take it to go away? Which I'm sure lots of people would like to know. And of course, I can tell you there are hundreds of studies in the literature which, they enroll football players, but no, they don't. They don't exist. But in general, it does take months and years for that to go away.
Okay.
All right. The other thing that you sometimes get, and this is, I'm not sure why this is, it's more of a problem in women than in men. And I don't know why that is.
Interesting.
But women get cellulite, and that's a similar process. And
Okay.
most people like a nice, smooth butt, and they don't like a lumpy butt, which is what
Sure.
cellulite is. And cellulite is the same thing. It's the tissues underneath forming fibrosis and not having the smooth muscle that is your butt.
So if I'm understanding you correctly, and I feel like the answer to this question is going to make me really sad, because some people wanted me to ask you if there's any way to get bruises back. God, I wish I could get my bruises back. I have not been able to bruise in about 5 or 6 years. No! But it sounds like what you're saying is the only way to get back that capacity is to abstain from play for a couple of years. Is that right?
Or to try a different type of stimulation.
Okay.
So if, there are many people in the spanking community, they like hands and they like hands and they only like hands.
Yeah.
But hairbrushes, paddles, canes can often create bruises. The other thing that people forget is, yes, you may like it on your butt more than any place else, but upper thighs, sides of your butt, other places may be able to bruise, and that may be part of the answer. But
Okay.
but it is very frustrating for lots of people in the BDSM community as a whole, as well as the spanking community,
Yeah.
that they can't bruise anymore.
Yeah, it's I'm mourn my bruises. I miss them sometimes, but what can you do? So the next question is quite broad, so I'm going to narrow it down just a little bit. From a medical perspective, is there anything that a person should absolutely never do in relation to a spanking? And what you said before led me to believe that there aren't a ton of very serious, pressing, common medical risks. So I'll specify this a little more. I know that a common refrain that I've heard for years in the spanking community and at parties is people always worry about kidneys. They always say, be careful of the kidneys, be careful of the kidneys. And while that is, of course, great advice, I then many years later was talking to a doctor friend. When I told him this, he kind of laughed and he said it would be really hard to damage a person's kidneys from a spanking, even if you're using an implement. Is that true? Is this something people in the community need to worry about, or are we being a little extra?
Okay. Let me try and break it down. First of all, think about where your butt is and think about where your kidneys are.
Where are our kidneys? I'm not even sure. I thought they were like my lower back, but are they higher?
No, they're more like your your lower part of your rib cage. If you feel the butt down here, you'll feel a rib. And if you go all the way around to the back, you'll be basically where your kidneys are.
So almost like the middle of my back, like not close to my bottom at all.
Correct.
Fantastic.
Now, if you think about it, an illegal punch in boxing is a kidney punch.
Of the other fight, it just.
And the real problem with the kidney punch is it stuns the kidney for a few seconds, and toxin build up. You get blood in your urine. There's a whole bunch of problems with it. But the chance of doing that with a spanking is pretty small. Now, maybe the problem is if, some people would say the sweet spot for spanking is the lower 1/2 of your buttock. All right. If you're in that area, there's essentially no chance of you're hitting the kidney. But if you remember, I sort of often talked about crush injuries. Crush injuries, in essence, the organ that's affected by it the most is your kidney. So it's not like, don't worry about your kidneys at all, but let's look at how much, pardon the expression, damage you're really doing to those tissues.
Right. That makes sense. Okay. My next question is specifically for tops, because although I am personally a bottom, I am endeavoring to make this channel inclusive to all members of our wide, wonderful community. So I wanted to ask, are there any medical concerns that TOPS specifically should keep an eye out for, like muscle strain, or I don't even know. Is there anything that TOPS should keep an eye out for?
Well, when tops spank, they
Mm,
can get a similar problem on their hand because the same
okay.
crush injury can
Oh,
occur
right.
and the hand, the anatomy of the hand is very complicated. Some of those bones are actually quite thin, and it's possible to actually break a bone or dislocate the bone. Uh,
Okay.
so I think when people really get into it, the sexual arousal dulls their sense of pain, and they should probably pay a little bit of attention to it.
Okay. So they should just sort of listen to their bodies and pay attention if something feels off.
Right.
So the next question again was submitted by a subscriber who wants to know, what is the best way to treat severe bruising, cuts, or welts?
I'm not sure there's a best way. In the
Okay.
community, I'm sure you've heard that arnica is the best thing to put on it. Again, no studies that show that, but everyone says, "Oh yeah, I use it. It's great. It really works for me." Use it.
Yeah.
The big thing you want to do is make sure it heals and make sure that that you don't get another infection if you break skin.
Right. So the next few questions are quite specific, as you, of course, already know, but I'm going to define the word for viewers who might not be familiar with it. Figging, which is the practice of using a piece of peeled ginger root in the way that a butt plug might otherwise be used, is very popular in the community. And people were wondering, is figging safe? Is it okay for us to be putting ginger where the sun don't shine?
Well, a couple of things. First of all, you have to start off with saying, are spanking enthusiasts clogging our emergency rooms? Are they? Are they? Is there a line out my door on Monday morning for the spankers who did whatever they did over the week? And the
That's
answer to that
funny.
is no.
No.
All right. So any injury from spanking, or for them and from all of BDSM, is
Yeah.
actually kind of rare. Now, there are people who either non-consensually spank, or there are some bad outcomes.
Yeah.
But in general, it's pretty small. So the one thing, now the figging, which is important, and I assume you know this, is if you put the peeled ginger into the anus and you relax, doesn't really hurt very much.
Yeah.
And then you clench because you're about to get a spank, it hurts more, and then the spank, and this is a process. And so the thing about figging is you want to try and make sure that either the piece of ginger doesn't break and fall into the anus. That can be a problem. Not a problem in that you have to go to the emergency room, but you may spend some time not having a very that won't be fun with this piece of peeled ginger irritating the inside of your rectum. So a lot of people try and take a big piece of ginger, peel it in such a way that they can tie a string or something around it, so that if it does fall in, they can pull it out.
That makes a lot of sense.
They try and carve it in such a way that there's a flange, so that it can't get sucked into the anus. That's actually more common than you think.
So that means a larger, like carved in such a way that there is a larger, like stopper, let's say, at the end.
Well, if you think of what a butt plug looks like.
Exactly. Yeah.
But in my mind, I think you need two things. You need the flange, and you need a piece of string or something to be able to retrieve it.
Okay. That's good to know.
I actually have this fantasy of making $1 million by designing some device that will leave the sides open so that the ginger will do its thing, but will be plastic or something that you could pull it out with.
Do it, Dr. Moser. Just take all my money. I'll be your most enthusiastic customer.
Shut up and take my money.
So you mentioned that the ginger sort of disappearing into the person's body is more common than we might expect. If for whatever reason that does happen to someone, and hopefully it won't, hopefully we'll all, carve our figs in such a way and potentially put strings around them that we don't have to worry about this. But if this does happen to someone, is going to the emergency room the correct thing to do? Is that what you would recommend? No. Okay.
No, only if it gets caught in a position where it's burning. All right.
Okay.
And I mean, and burning for more than, a few minutes. And in most cases, if you move into the position that you would use with a squat toilet, and the person who was using, who put the ginger in, takes a finger and tries to, remove it, most of the time you can reach it. And
okay, so it sounds like if someone has some bad luck, we shouldn't panic, just remain calm and see if we can fix the situation ourselves without, clogging up an emergency room, which of course, especially these days, are already so overburdened.
Correct. And obviously you don't want to be waiting in the emergency room next to the COVID patient.
He's like, sorry, doctor, I lost a knobby rhizome up my bum.
But we actually there are actually not a lot, but some people who lose butt plugs or vibrators into the rectum, and sometimes they actually have to go to surgery to get them out.
Oh no. So yeah, we should really listen to your advice about carving the figs in such a way and using strings to make sure we don't end up in that situation.
If it's in a place where, there's a normal process your body has of getting stuff out of there. And so if it gets out of there, you don't
what
have
goes in usually comes out. So
one way or the other.
Okay, so my next question is another sort of side dish to spanking, and this one really needs no explanation or description. Everyone immediately knows what this is, and I am, of course, talking about mouth soaping. A lot of people sometimes, I've even felt this way too. I've had soap in my mouth, and I've thought, oh no, am I sucking on poison right now? So is there anything that aficionados should keep in mind to practice mouth soaping in a medically safe way?
The actual bar soap, and actually I know you're in Mexico, so I tried to figure out if this was true in Mexico or not. But in the United States, bar soap is non-toxic.
Fantastic.
It probably means that you should not use the antibacterial, floral scented bars, but just a plain soap bar. And by itself, that's not it. But there's a caveat here, in that there is a certain amount of toxic material in dishwashing soap, the liquid that you buy in the squeeze container, and that you probably have to drink the entire bottle to get sick. But that's probably not a good idea, and especially since if you like soaping, go for it. Just use plain soap.
I know most of my viewers are in the United States and Europe. So I know the ones in the United States will be very, very happy and relieved to hear you say that in the States, antibacterial soap is non-toxic. So if you're outside of the United States, please look into whether that's the case in your country as well. I'll find out whether that's the case here in Mexico, fingers crossed.
And I just want to be clear, I would not use the antibacterial soap. I use plain soap. Antibacterial soap has other things in it.
Okay.
Not toxic, but the purpose of soaping is not to destroy the bacteria in your mouth. You don't need an antibacterial component.
So just plain basic soap, unscented, keep it simple.
Yeah.
That makes sense. The next question is for specifically for people who want to enjoy spanking during pregnancy. Are there any health or safety tips that they should keep in mind?
I have to defer to the person's obstetrician at that point, because there are some people who have very precarious pregnancies, and and people even standing up can cause a miscarriage. So we have to be more careful in that sense. And then depending on where you are in the pregnancy, if you're 9 months pregnant, maybe laying on your belly and having some person wail on your butt is not the best plan.
Okay.
Now that doesn't mean it's bad. It just means, let's not have things go wrong. And
Sure.
and the other part of the pregnancy issue is if you start having contractions and it's time to go to the hospital, you probably don't want to be explaining to the doctor and nurse that, oh, those bruises on my butt are just fine, that was all consensual. And
Yeah, you've got other things to think about in that moment. So it sounds like the most important takeaway for this question is that people who are pregnant should really just consider trusting their OBGYNs to give them, compassionate and understanding medical advice that is tailored to that person's specific pregnancy.
That's right. And it may be that I will get a phone call from some of the gynecologists in my hospital and say, hey, I got this patient, 38-year-old white female who's, this is her fourth pregnancy and blah, blah. She says she wants to do this. What do you think? And then we'll discuss the medical aspects of it. So, in general, and this is true of even people who aren't pregnant, you always have to take the person's history into account. If you have someone who's a hemophiliac and bleeds a lot, well, maybe I should.
That's a whole different set of concerns.
And I have a couple of patients who are on anticoagulants for medical reasons, making their bleeding much more significant. We may want to, talk with them as well. Right. Those are separate cases. The average, generally healthy human, not a problem.
Well, and that leads us very perfectly into my last question, which is, do you have any advice for members of the spanking community, but also for the general world of BDSM communities for finding a kink-aware or kink-friendly physician?
Actually, I wrote a book about this, and I'm in the process of writing a follow-up, a second edition. But awesome. In general, what you want to do is sit down with your doctor, not when you're walking in with some injury, and say, I want you to know this about me. Is this going to be a problem? Can you handle the fact that you might see blisters, bruises, cane marks on my butt? Is that a problem? And if the person says, yeah, find another doctor.
Okay.
And if the doctor says, yeah, I have lots of patients like that, it's not a big problem, don't worry about it, you may have found a new doctor.
Awesome. Well, thank you so much for taking the time to answer these questions, Dr. Moser. I know you're busy, and so we're very grateful to you for sharing your time and expertise with us.
No problem. Thank you.
Bye.
Bye.